Now we're going to look towards the inside of your knee, and that's the part that's your medial meniscus there on the inside. And we're going to put a little, I'm going to grab your leg here, and I'm going to put a little tweak on it. Let's bend it down. Keep it straight if you can. And now we're looking all the way to the back of your knee. So remember I was talking to you about the two different types of meniscal tears.
Yep.
You have, it's degenerative, but I don't see a flap where it's a mandatory need for surgery. Now what I'm going to do, just to be sure, is we're going to take a peek through that side, because arthroscopy is all about angles, and if we
through the medial side.
Exactly. Yeah. So everything else in your knee looks fine, but I just want to make sure that there's not a sneaky tear there all the way in the back of your knee.
Got it.
So it's just going to be one more stick. There we go. And now we can see from a different angle, and that's the posterior horn there. Now, I'm going to squirt a little more fluid in there and make sure there's not, you see how that's a little tricky looking there? That maybe a flap tear back there.
Does the fluid open the joint up?
Yeah, and it just clears the view. Yeah, so you do have a little tear back there, and then some inflammation. But I would tell you that if this doesn't bother you, it doesn't bother me.
Right.
From a surgical standpoint. So what we're going to do is I'm going to inject a little cortisone in there, because that inflammation we showed you, hopefully that calms down your level of pain and discomfort. So when you have your golf trip in a couple of weeks, I don't want you slicing one into the woods and grabbing
blaming
your knee.
it on the doctor,
me.
right?
Yeah, okay.